Whoa, 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 whoa. You travel how far to get hearing aids? Hey guys, welcome back to the DrCliffAuD vlog. This is vlog number 282, and today I want to talk to you guys about the concept of traveling long distances to get your hearing loss treated. But before I do me a huge favor, click the like button, really helps out the channel, and if you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well. It is greatly appreciated. So, back when I first started the clinic in 2017, in order for me to get a loan, which is like, I don't know, a $200,000 loan in order to start the clinic, I had to develop a business plan. Now, I had the fortunate benefit of having gone through a student business plan competition. I got second in that competition, but I digress. Nevertheless, it required that I spoke to a lot of different people who were inside of the hearing aid industry, other private practice owners, loan officers. SBA has a program that you can go and get advice from. And the general premise around the business plan is that it's a lot of assumptions that you have to make. So, for instance, how much are you going to charge for hearing treatment based on other clinics in your local area? What type of patient are you looking for? What brands of hearing aids do you think that you're going to want to use? There's a lot of different assumptions that you have to make because you're not actually running the business yet. And you're also making assumptions on how far someone is going to be willing to travel to see your clinic. So you look at the demographics within a certain area. It's usually around 10 to 20 mile radius, depending if you're more rural or if you're more in a city. And so for my purposes, I'm in more of a city in the greater Phoenix area. So there's a higher population density, but there's also more competition in the area. So the assumption is that, well, if anyone lives further than 10 miles away from you, you are not going to be the hearing care professional that they choose to see. They're going to go to someone who's much closer than you. But here's the thing. As I first started the clinic, and fortunately I was able to get funded, I started up in Anthem, Arizona. I would say a relatively smaller community. I think there's around 60,000 residents at the time where I set up my clinic, and there was no other competition in that immediate local area. And so I focused all of my attention on doing community outreach, giving talks at community centers, reaching out to the local physicians, all of that stuff, the typical stuff that you would think of if you're in a local community trying to attract patients and getting the word out that you're actually servicing that particular area. And so I did that for a while, but at the same time, you may have noticed that this was around 2017, I also started my YouTube channel. And so I ended up creating a ton of videos over the course of a year, and it took like 6 months or so, a little longer than 6 months, for the first patient to come into my clinic from the video content. And they actually had traveled up from Gilbert. Now, if you're not familiar with the greater Phoenix area, Gilbert's kind of on the southeastern side of the Phoenix area, and Anthem is like north central area of Phoenix. And so when you think about it, it's like this individual rather traveled a really long distance to come see me. In fact, he had traveled, I think with traffic, it was like an hour or more just to get to my clinic. And I just remember thinking like, that's interesting. You elected to travel over an hour driving by dozens of other hearing care centers just to come to me. Now, why is that? And he's like, well, because I saw the passion that you had for treating hearing loss, because that passion came across in your videos. And so he was willing to travel substantially further away to come to my clinic to receive care. And that's kind of when the light bulb moment went off for me. I started to realize at that moment that people are willing to travel much longer than the traditional distance than you would expect for hearing care in order to go to someone who was really good or really passionate about what they did. Now, at the time, I'll be honest, I was probably more passionate than good, and I think that at this point right now, my passion and the quality of care that I'm able to deliver are on par with each other. And I think that, over the course or since 2017, depending on when you're watching this video right now, since 2017, I've seen a significant increase on the amount of distance that people are willing to travel to come see me in my clinic. And I would say that the majority of patients that I see in the clinic travel substantially further than the typical 10-mile radius that we would make an assumption about inside of a business plan. And so here's the other thing. So I had an individual that just this last week come into the clinic. She had been my patient before. I'm talking several years ago, was my patient. She traveled probably around 35 minutes to come in and see me inside of the clinic. And she was doing great with treatment, But all of a sudden, I just noticed that she wasn't coming in anymore. And I'm like, that's interesting. And, tried to reach out, never responded back. It is what it is. Well, here, a couple years later, she comes back into the clinic and she's like, hey, I think I need to come back. And I'm like, okay, well, why'd you leave in the first place? She's like, well, you're just too far away, and I just really wanted to have someone who was more local to the area that I live in. So she started going to a different professional. And so she was going to the professional. She was reasonably happy with that professional. But when it came time to upgrading into new hearing aid technology, she ended up getting new devices, but the provider that she was working with didn't spend hardly any time with her to set the devices up correctly. They didn't do reader measurement. They didn't follow best practices. And she was like, you know what? The quality of care just wasn't as good as what I experienced inside of Applied Hearing Solutions several years ago. So she made the decision to travel the distance again and come back and see me inside of the clinic so we can get everything squared away again. And that was really, and obviously that's what's prompting this video here today, but it really got me thinking about this idea that a lot of people are unwilling to travel outside of their immediate local area, and I get it. Like, I love having everything that's important to me being within 10 minutes of my house. I love every aspect of that. But at the same time, when it comes to hearing treatment, by not going to the best provider in your area or even outside of your area, you're setting yourself up for a tougher time when it comes to hearing treatment. It would actually be more worth it for you to travel hours, several hours, to get to see a hearing care professional who does things the right way, because a lot of the work that they do is front-loaded, meaning they got to get you set up the right way, but once they get you up on your feet and get you trained enough to be self-sufficient, then you don't have to travel in and see them as much. But on the other hand, if you go to someone who's more local and you keep spinning your wheels because they're just not doing the things to get you up to full speed from a hearing treatment perspective, you end up spending way more time going to the place that's just really local to you that doesn't know what they're doing, okay? So this is kind of, when it came down to me developing the Hearing Up Network in 2019, I wanted to make sure that individuals with hearing loss had a better local option so they didn't all have to fly out to see me inside of my Arizona clinic, because a ton of people are flying from different states to come get treatment inside of my clinic. And I would rather them get an excellent hearing care professional in their local area. So I developed the vetting program to where Hearing Up members go through this vetting process, they get approved at the end of it, and then they get listed on hearingup.com. So if you're looking for an excellent hearing care professional in your local area, go to hearingup.com. I promise you will not be disappointed. That being said, I get people who email me all the time, who are looking to find a professional in their area. They go to hearingup.com and they're like, Cliff, I'm really bummed out because the closest Hearing Up provider is like 45 minutes away, and that's like super far away. And I'm thinking, are you crazy? You have an excellent hearing care professional, someone who's been vetted by a third party. And I'm telling you that, like, if my mother lived anywhere even remotely close to that clinic, that's where I would send my own mother. And you're saying that that's too far? 45 minutes is too far when you probably realistically are going to go in for 2, maybe 3 visits to that professional over the course of the first 2 months. You can't make an accommodation to make that trip a couple of times to make sure that you're getting the best hearing treatment possible. And then after that, you can do some level of virtual care or just go into their clinic 1 to 2 times a year to get your treatment updated. Like, it blows my mind. But honestly, it's because that's the way that our industry has set it up. We have created this expectation that you should just be able to go down the street to your local hearing care professional and get hearing aids. And if you've been watching my channel for a while now, you know that not every provider is equal, okay? Now, I think that a lot of hearing care professionals have really good intentions, and that's terrific, but good intentions do not equal optimal results when it comes to hearing treatment. If you want to get the best hearing treatment possible, you have to find the best provider and then travel to go see them. I don't care if it's hours that you have to travel to go see them. I don't care if you have to fly to go see them, and I don't care if you have to figure out a way to trick a family member to driving you to their clinic so you can make sure that your hearing is being treated properly. Okay, that is how important your hearing is to me, and that is how important your hearing treatment should be to you. That being said, let me know what you think. Do you think that traveling further than 10 miles or 20 minutes to a local hearing care professional is ridiculous? Or do you think that you should be able or willing to travel unlimited distance to find a hearing care professional who's perfect for you? Let me know down in the comment section.